In the rehab world, we have a lot of difficulty getting our patients and our clients to continue with some sort of activity or exercise long after they've seen us. We'll often give people an exercise sheet. That exercise sheet will either get filed away or thrown out, stuffed into the bottom of a drawer, and then it won't get done ever again. We have this constant problem in rehab where we understand that if people take care of themselves throughout the day, that they're less likely to have to come in because of an injury. They're less likely to have to come in, especially for something creeping up where there's no mechanism of injury per se, whereas like if you fell on your knee and it was sore, or you fell down the stairs and you have a bunch of issues lingering after that. But the issues where my knee just has been hurting a little bit more every day, my back's been starting to bother me and get tight, these are the type of issues we run into in the rehab world all the time. We would love for our patients and clients to do some sort of exercise and activity outside of here, but it's really difficult when there's no end goal, especially with movement and activity. We accept it really well with dental hygiene that we're going to brush our teeth, not because we're trying to reach an end goal, but just because we have to do it. There's sort of a social stigma against having really bad breath. So we brush our teeth, we floss, we do our mouthwash, we do everything we're supposed to do on that. But having a little bit of low back pain, there isn't much of a social stigma to that. There isn't an outward issue with having a little bit of knee pain. It doesn't make you smell bad. It doesn't make you, unattractive or anything like that. It's just your knee just hurts. And some people may not even know it hurts. You may be walking around appearing to be just fine. But if we try to give people activity, a lot of times it comes down to, well, how many sets, how many reps, what should I be doing next? Should I be progressing in weight? And I've even lost clients over this same idea that, well, we're not progressing in weight. We're just doing an activity. And what they're not seeing is that they're getting better at the activity, and that activity is actually helping translate into other parts of their lives. But they're so used to the gym type model where sets, reps, adding more weight, adding more reps, some sort of obvious linear style progression where if you do more, you gain more in terms of reps and weights. And activity doesn't really work that way, but activity has a far greater benefit, a benefit that we're going to talk about when it comes to things like Indian club swinging in general, stick swinging, martial arts, dance. We're going to talk about all those things today in the podcast, and how you, on the rehab side, if you're a rehab professional, should start to incorporate some of these things into people's exercise programs while they're under your care, and what that's going to do for activity compliance and risk reduction after they leave your clinic. For the patients that may be listening to this, people who have gone through physical therapy or people who may be going through physical therapy right now, adding these type of things to your routine, to your corrective exercise, as you will, is going to help you in the long term not become a patient again, and give you an organic way, per se, of continuing exercise and continuing activity to keep yourself healthy. We're going to talk about that during the podcast. What I want you to do during the intro is take a little note. There's a scene where I'm swinging the Indian clubs during the intro. I want you to take note of that. We're going to break down some of that stuff today on the podcast and talk about what all that means and how it will benefit you as not only a therapist, but benefit your patients as well. We'll see you on the other side. Stop defending mediocrity in our profession. Welcome back. I hope you took a little bit of time to take a look at some of that Indian club swinging in the intro. We're going to talk about a little bit of that today during the podcast. This is the Dr. Krol PT and Fitness Podcast. I am your host, Dr. Lee Krol, as always. And we're going to be talking about different types of activity. I'm going to focus a little bit more on Indian club and stick swinging today than anything else. But we're going to talk about what all that means for you in terms of the rehab side, what you can do for your patients, And we're also going to talk to the patient side of things as to what these things will do to benefit you down the road and why they're, in my opinion, a better alternative to here's your corrective exercise sheet, do this forever. And there is a little bit of benefit to that. For certain people, these are things I want them to do pretty much forever. I want them to be your musculoskeletal hygiene per se. I talked about that in a previous video where I talked about musculoskeletal hygiene and maybe couldn't we do something every single day. Well, this is part of that musculoskeletal hygiene. It's just organically entered throughout your day. I started martial arts when I was 14 years old. My parents got me involved in Ishinryu karate when I was a kid. That was a long time ago, but I still practice martial arts to some degree. I'm not a heavy practitioner. I'm not concerned about getting belts. I'm not concerned about going into competition or anything like that, but I do practice with some regularity. Once a week I'm doing Brazilian Jiu-Jitsu. I'm hitting the heavy bag once or twice a week. I'm constantly doing stick swinging, knife swinging, and working on that. It's not, again, I'm not training 6 days a week for it. It has not consumed my life, but it is something that I keep my skill set reasonably sharp on. My belief in terms of martial arts, which again, I'll talk about this in a later podcast. I'm hoping to have somebody on to help me talk about this. My basic belief for me is that I just want to be able to defend myself against an average person who's a little bit bigger and a little bit stronger than me. I want to be able to take care of myself if that ever comes around. But there is a certain benefit to doing martial arts, and there's a certain benefit to stick swinging, club swinging, knife swinging. There is a certain benefit to dance. There is a certain benefit to doing these things that grooves your movement patterns throughout your entire life and gives you an avenue, an easy accessibility avenue to perform activity throughout the day. One of the things on the rehab side, I'm going to talk to the rehab professionals first on all this, is that we have a problem with compliance. We have a huge problem with compliance. We have difficulty getting our patients and our clients to do any type of activity or exercise. One of the big tricks with compliance is to give people less. Instead of giving them 9 exercises you want them to do 3 times a day, that's 45 minutes 3 times a day. They're not going to do it. Nobody's going to do it. So maybe give them 1 or 2 different things. One of the nice things about the McKenzie repeated movements is even though they're done usually with an hourly prescription, maybe every other hour is what I give people, they're really quick. You're doing 10 to 15 repetitions of a repeated movement and it takes about 30 seconds. It's very fast. So there's not a lot of excuse why they can't do it. And it's going to help them, so that's even a bigger incentive to do it. It's another way we increase compliance is show the patient that this is actually beneficial. And that's one of the things I do where they test and retest when I work with my rehab, customers and patients. Show them, have them do a movement, something from an SFMA top tier or an SFMA breakout, do an intervention, whether it's a manual or an exercise, retest, and if it makes it better, okay, now we know we have something that is actually effective for you. You can do this on your own. That increases compliance by quite a bit. And then again, I only give them maybe 2 things at most, maybe 3. It all depends on the client or the patient. But again, you want to give them an easy accessibility avenue to do their activity. Now, how does that work going long term? What should you be doing? If you wait till the very last session that you're going to see them and you try to introduce something brand new like club swinging or tell them to go take dance lessons or go into martial arts, it's probably going to fall flat. It's just that kind of outdoor scattered advice that you give them, which is all good advice, but it doesn't really stick because you haven't ingrained it in the process. One thing I really like to do is I like to introduce Indian club swinging. So if you look, I'll pop up a video right here that's going to show a pretty basic windmill type movement. So you can see an inside out windmill right here with both arms, and I can make this as complicated as I want. I can add in twirls, I can alternate arms, I can change directions, I can do even standing on one leg like I did on Bosu ball in a previous Instagram video. But this is just a very basic club swinging pattern. And to the person who's never swung an Indian club or any type of stick before, these patterns look really intimidating, even though I'm doing them at a relatively slow pace. I can do these much, much faster. But to them, seeing a twirl like this where I add in the ring grip, this becomes like, oh my God, I can't do this. If you just tell them to go watch some videos and try it, they're not going to do it. But if I'm working with someone, and it can be anything, because the body works as a whole, you're going to get benefit from doing all sorts of things. I start them off right here, which is just the very basics. I can teach them that windmill in about a minute. And I teach them the basics. This is just grips right here. So that's closed grip to open grip. I've seen it called saber and hammer as well instead of closed and open grip. But I like to use closed and open grip when I'm talking to my patients and clients. And it's just a very basic grip. That's your ring grip. I can show them the ring grip part where right here I'm showing them the ring grip, and that's how you get your twirl. So look what I'm getting here with that ring grip. Look what I'm getting in terms of movements. For me to do these movements appropriately, I have to have good scapular stability. The scapula has to be pretty stable to do these movements well. I have to have good wrist and elbow control, flexion, extension, radial deviation, ulnar deviation, fluid circumduction. I have to have all of that to go into that ring grip appropriately. When I'm doing the club swinging, so if you go back to see the windmills that I was doing, I'm breathing during this because this is taking a little bit of time. It's a repeated fluid movement, so I'm breathing during this. What benefit am I getting from that? From a rehab perspective, I'm unlocking the diaphragm and I'm unlocking the breathing pattern while something else is going on. So I'm dissociating holding your breath with doing some sort of a movement. And that's a really important thing. We often find that our patients and clients are holding their breath when they're nowhere near maximum effort. So why are you holding your breath? Why has that pattern been engraved that I have to hold my breath and lock down my thoracic spine, hence interrupting my shoulder stability? We want to use something like club swinging to really introduce the idea that, okay, we can do something reasonable, we can do something active, and be able to breathe during the process. But if you look at the club swinging activity, for me to go from this type of closed grip, open grip, even ring grip, but I just usually start with closed grip and open grip right here. For me to go from that to the windmills that I was showing earlier, for me to teach someone that takes about a minute or two. It doesn't take very long. It's something that I can do pretty quickly. Now, a sidebar, if you're stacking 4 or 5 patients at the same time and you're seeing running around your clinic, you're not going to have time to teach someone how to do Indian club swingings. It's just not the right answer, but you're practicing at a poor level. So knock it off. Anyway, the club swinging that I'm doing here takes about a minute or two to introduce to them. What's nice about this, it doesn't have sets. It doesn't have reps. They're going to go from a basic club swinging pattern, just a basic windmill pattern, to changing the direction of the windmill, to changing alternating the arms, doing both arms at the same time. So synchronous, asynchronous upper extremity movement, which is just grooving different movement patterns in their brain. And the whole time, they're not concerned with, okay, I'm trying to get as much external rotation of the humerus as possible. I'm trying to get as much flexion as possible. You're not worrying about that. You're just getting the movement right. And in the process of getting the movement right, what you've accomplished is all of those other things. You're getting PNF type patterns. You're getting all the osteokinematics you could ever want at the glenohumeral joint. You're getting the breathing under control. You're getting posture, because if you have poor posture, you're going to bonk yourself with the club. So you're getting all of these things, all of these benefits, without really worrying about, hey, we're going to give you an exercise for every single one of these. We don't have to worry about that. We're getting all of these benefits. On top of that, you're introducing a skill set and an avenue that they can play with. So one of the great things about kids is we send them to a playground and we just let them play. We don't say, okay, you have to be on the monkey bars for 2 minutes and then you have to climb the ladders over there for 2 minutes. We just tell them, we're going to spend a half hour here on the playground and you're going to play. And they're going to introduce themselves to any type of movement pattern that they want at that time. It's going to be climbing, it's going to be crawling, it's going to be sliding, it's going to be jumping, it's going to be running. They're going to be introducing themselves organically to all those movement patterns. When you introduce something like club swinging or dance or martial arts, you have introduced your patient to a different activity that is going to capture so many of these movement patterns that you want. It's going to capture so many of these musculoskeletal and neurological components that you really want to capture and maintain so that they don't become patients or clients again. If you have an upper extremity issue, neck, shoulder, anything upper quarter, epicondylitis, medial or lateral epicondylitis, carpal tunnel, upper extremity radiculopathy type symptoms, whether they're cervicogenic or something down the chain, it doesn't matter. Indian club swinging is something that you can really add in to any type of movement pattern, all right? If you have a hip issue, you may be thinking, well, who cares if I have someone with a hip issue or a knee issue, why would I ever add in club swinging? You can change your position. I have a video that I'll pop up here in a second. Let me bring it up here, where I'm standing on top of a Bosu ball. And again, you don't have to stand on top of a Bosu ball. You could just stand one-legged. You could stand in a tandem stance. You can stand in any type of stance that you want and start to gain ankle, hip, knee, lower quarter stability while doing something like club swinging. As you can see, I'm making it much more complicated here with some of the twirls and some of the movements, but I'll switch between my left and right leg on the Bosu ball. And they can do this just standing on a floor. They don't have to have a Bosu ball. But I'm gaining, again, posture, hip, knee, ankle, all that type of stability, locking all of it in with a good breathing pattern. But I'm not concentrating on it. I'm concentrating on the club swing. I'm concentrating on the patterns that I'm doing with the club. I'm not thinking so much about, okay, I have to work on this particular movement here. I have to work on this particular motor pattern. I'm just playing with the clubs. This is not pre-rehearsed. This is not me looking at a whiteboard saying, okay, do this swing next. This is just me swinging the clubs and having it on video. And that's really what you want with your patients or clients. You want them to have this avenue where they can go down. One of the things that happens with me, because I've been doing this for so long, if I have some sort of a stick or a pen or anything in my hand, I am forever twirling it. I am forever moving it and manipulating it. I can't turn it off. I'm always gaining that control. I always want to explore that type of movement pattern. One of the things I see from people who are much more serious about fighting than I am and competing than I am, they're constantly doing this. They're constantly got the head bobbing, they got the hands up, they're constantly doing the movements here. Whenever they're doing anything with their hands, if they're in jiu-jitsu, it's always a grip or some sort of a hand position that they're working on. And it's not because, okay, I need to get my reps in of this hand position. It has nothing to do with that. It's just their body has a desire and it's yearning for that type of movement pattern. Dancers are much the same way. Dancers are constantly exploring dance movements. They're constantly moving in a certain way. They'll constantly throw some sort of a little movement in while they're walking or while they're just standing around. It's very difficult for them to stand still because their body is just yearning for this type of thing. One of my patients, clients, a couple years ago, I introduced him to rolling and crawling. I was trying to work on a lot of his balance. So 14 years old at the time, working on rolling and crawling. And one of the things his mother told me was that he's crawling around all the time. He's crawling around and rolling around all the time. You know, he's not doing it because, okay, I have to do my exercises now. He's just doing it. And even when he was working with me, we were working at a different location at the time. Even when he was working with me, when I'm talking to him, he'd be on the ground rolling around or doing something. And all that was his body's yearning to explore that movement pattern. You've started to go down a different path with your body, and your body wants more of it. Your body wants to do it more often. It wants to really get into that motor pattern and really open up those neural pathways. And these are the things that happen when you introduce activities that are fun, when you introduce activities that are not set and rep related, but they're just skill dependent. You're going to get better at this. And as you get better, you'll be able to explore more of it. People who do yoga are very similar. They're doing yoga everywhere. They're doing handstands everywhere. You have people who are really, really involved in it. Now, there is a little bit of the Instagram yoga side of it where they're just doing it to take a picture on Instagram and show it off. But overwhelmingly, they're constantly just doing things without cameras on them at all. They'll go down, I go down to the Niagara Falls Gorge a lot, and I'll see people on the rocks doing all sorts of goofy stuff. You know, nothing unsafe where they're going to fall in the water, but you know, they're constantly doing like a warrior two or a tree pose or something like that on the rocks because it's a nice background, it's a nice area, it's something different. But again, they are just trying to explore those movement patterns. And again, on the rehab side of things, if you're introducing this at the very end, let's say the person's on their last visit, or that you feel they're on their last visit, you're going to discharge them from medical care, and you just pick up an Indian club at the very end and say, here, let's go over swinging a little bit of this, it's not going to stick. As long as it's medically appropriate to do the club swinging throughout the session, then you should be adding it in a little bit at a time. You should be introducing them to a little bit of club swinging and just getting them used to it. And if you don't know how to do club swinging, that's fine. You can either go learn or find something you are good at from a skill standpoint and introduce that as well. You really want people involved in these types of things. Martial arts and dance is another thing that you can involve. I'm not anything for dancing. I don't know anything about dancing. So for me to teach anyone how to dance would be absolutely disastrous. So that's not going to happen on my front. But I can introduce them to a little bit on the martial arts side. I can introduce them to a lot of things on club swinging. And I can introduce them to a lot of things on yoga, which is what I do. I'll often give people a sun salutation as part of their exercise program. Just do this. And it's got so many things that it catches in that sun salutation. As long as it's appropriate for them, you're getting all sorts of spinal movement, you're getting all sorts of posterior chain movement in terms of the musculotendinous complexes, you're getting all sorts of neurological input from this, you're getting traction and compression amongst a whole series of joints on here if you go through the downward dog and the cobra and everything else. So you're gaining a ton of benefit at a whole body level. And one of the things that we have gotten away from in rehab is looking at the body as a whole and giving people something to do for their entire body, not just the area in question. We tend to concentrate on just where they're pointing. Hey, it's my shoulder, it's my knee, it's my neck. Instead of giving them something that's going to be kind of all-encompassing and letting that issue that's problematic, let's say it's your shoulder, your elbow, your wrist, whatever, and incorporating that into a larger movement pattern. That's really kind of what we're looking for. Activity such as club swinging, yoga, dance, martial arts is a really good way to get involved in that and start to groove a movement pattern that their body is eventually going to become interested in and that their body is eventually going to want to continue doing. So that is really, really important for all of you, especially on the rehab side. Start introducing your patients to things like club swinging, stick swinging, baton twirling, anything that you have a skill set at, you want to bring to the table if it's medically appropriate and start getting your people doing these types of things. I'm a huge fan of club swinging. I'm a huge fan of dance. I'm a huge fan of martial arts when it's done appropriately because of the movement patterns that they constantly ingrain in people and they constantly, keep having people do more and more of, where they just want to just explore that movement pattern. They want to be on the floor rolling. They want to be crawling. They want to be doing gymnastic type movements. And you don't have to be a gymnast to do these things. Again, club swinging can be done by pretty much anybody. I mean, there's a couple people who, maybe they lack the upper extremity mobility to do it, but they can do it to some degree, and they're still going to get some benefit out of it. I give this to a lot of different people, and I'll have people order clubs through me. I don't do it for a profit. I have them order the clubs through me, and I get them the Indian clubs, and I teach them how to use them. It's very simple, and I have someone who I see every month or two. He comes in just to make sure he's doing the right things, and he's where he needs to be. He comes in, and he said, I do the Indian clubs every single day. I do them in the morning, and I haven't had the problems in my arms. I haven't had the numbness in my arms and hands that I used to before. I'm a lot stronger through each side, and it's just something that I can work on and play with instead of saying, okay, I have to set a timer and do this for a minute, or I have to do this pattern 10 times. He just plays around with it, and he's getting better and better at swinging the clubs, and he's starting to explore his own club swinging patterns. He's starting to look at things online and say, oh, that's a different pattern, I'm going to try that. And that's exactly what you want to do. If you just give your clients an exercise sheet and say, here, go ahead and do this forever, there's really nowhere for them to go off that. They really can't expand off of that. So think about adding those things into your exercise routines for your patients. Think about all the things that I can do for them. This is Dr. Lee Krol, and I will see you next time on the Dr. Krol PT podcast. Don't forget to hit that like button. Don't forget to hit that share. Don't forget to spread this around to all the different therapists and patients out there, the benefits of club swinging, dance, martial arts, and all of that. We're going to keep talking about these things. We're going to keep talking about the topics that'll help you make your patients better, and it'll help you on the patient side become better and be a better patient and have less risk for injury down the road. This is Dr. Lee Krol signing off. I will see you next time.